It is winter, and it's important to keep your family well. Antibiotic resistance is a serious public health risk to us all now and increasingly in the future. You may have heard it referred to as antimicrobial resistance, or AMR, and I want to talk to you about what happens when bacteria, which can cause infections, become resistant to the antibiotics we use to treat these infections. You see, it's the bugs that become resistant, not us. And infections can range from wee infections to more life-threatening, such as pneumonia or blood poisoning, sepsis. And the antibiotics are the drugs that can save lives and extend and improve lives for many people. They kill the bacteria which cause the infection. Imagine a world without them. Something as simple as an infected cut to your finger could leave you fighting for your life, and routine operations like hip surgery or indeed caesarean sections, and 1 in 4 births in this country are by caesarean section, could become deadly. Unfortunately, using antibiotics when we don't need them, or not always taking the full course properly when we do, gives bacteria in our bodies that opportunity to develop resistance to antibiotics. These bacteria that are resistant then multiply and spread, so that the next time someone needs an antibiotic to treat a bacterial infection, they don't work.
We can all play a part in delaying antibiotic resistance and preserving the antibiotics that we do have. Now, there are certain things which antibiotics can't treat, including colds and flu, and yet these are when they're most commonly taken.
All parents want to help their little ones when they're unwell, so here are some top tips from us. Make sure you regularly clean surfaces such as your computer keyboard, telephone and door handles to get rid of germs which can be passed on.
Everyday things at home and in public places can easily get contaminated with the flu virus, so it's important to wash your hands and your child's hands frequently.
Always cough and sneeze into a tissue and put it into a bin as soon as possible. Coughs and sneezes really do spread diseases.
And don't forget, keeping yourself and your children warm over the winter can help prevent illness. Heating your home to at least 18 degrees or 65 degrees Fahrenheit and wrapping up when you go outside will help keep your family well.
Sore throats, colds, coughs and earaches usually do get better on their own without antibiotics. If you do feel unwell, drink lots of fluids, rest and make sure you get at least 1 hot meal a day.
You won't get better overnight. A sore throat usually lasts a week and a cold could last 10 days. You can use paracetamol or ibuprofen, but the best thing to do is to speak to your pharmacist, who can advise on the best medication.
Understandably, GPs will always get pressure, especially from parents, to prescribe antibiotics every day. And I know that your worst fear is your children getting ill and you want to protect them. But trust us to know when you and your family will need antibiotics. You don't need to ask for them. But if you are prescribed antibiotics, then make sure you finish the course so they kill off the infection. Don't save or share antibiotics either with anyone else.
So, antibiotic resistance is serious, but we can all do our bit to help keep our families well now and in the future. I believe we can preserve the antibiotics we have if we all act together now.